The healthcare sector is under pressure like never before. Lives are on the line. Facilities are expanding. Technologies are evolving. But there's one overlooked skill, that determines whether these projects save lives or waste millions. Master healthcare sector costs like a pro, full lifecycle guide. Billions are poured into healthcare infrastructure and innovation. Yet too often, projects stall. Equipment is ordered too early or too late. Costs balloon. Stakeholders clash. And patients? They wait. This isn't just mismanagement, it's a lack of strategic cost control. In 2023, a hospital in the Midwest opened 9 months late, $58 million over budget. Why? Lack of coordination between cost planning and operational needs. The most important dollar in a project is the first one planned. In healthcare, this means aligning clinical outcomes, facility design, and financial strategy from day one. Involving clinicians and finance teams early. Aligning scope with community health needs. Defining a cost-aware work breakdown structure, WBS. One children's hospital plan construction and equipment acquisition together, saving $3.2 million in logistics and downtime. Estimating costs in healthcare is different. You're not buying bricks. You're forecasting the price of complex medical systems, labor, logistics, and risk. Using historical data from past facilities. Parametric estimation for high-tech installs. Contingency planning for regulatory and supply delays. A medical research lab saved 18% by using real-time market pricing tools, adjusting equipment estimates monthly, not annually. In healthcare, budgets aren't just about costs. They're tied to funding rounds, approvals, grants, and compliance. Your budget must speak finance and function. Phase-based budgeting, design, procurement, build, commission. Integrating CAPEX and OPEX forecasts. Real-time variance alerts. A cancer treatment center tracked budget by department. When radiology costs surged, they rebalanced early, saving $850,000 and avoiding project delay. Projects don't fail in planning, they fail in execution without control. Control essentials. Earned Value Management (EVM). Cost Performance Index (CPI). Regular cost review boards. Variance trend analysis. An ICU expansion project in Southeast Asia used cost control software with weekly variance tracking. It avoided a $1.1 million overrun just by spotting early contractor delays. Here's the truth. The best cost isn't always the lowest cost. In healthcare, value is what matters most. Strategic points. Lifecycle costing, maintenance, staffing, energy. Total cost of ownership, TCO, versus upfront bids. Optimizing tech upgrades versus retrofits. Cost/value ratio in patient-centered design. A hospital group avoided $12 million in future costs by investing 15% more in a modular HVAC system, cutting energy and maintenance costs for 20 years. Let's recap the life cycle of smart cost control in the healthcare sector. Strategic planning. Smart estimating. Dynamic budgeting. Proactive control. Optimum cost strategy. When these 5 phases align, healthcare projects become efficient, resilient, and focused on what matters most: better outcomes for patients. This guide gave you the big picture. But now imagine mastering every detail. Enroll today, master cost control in healthcare projects, and lead with confidence. In healthcare, cost management isn't just about money, it's about mission. It's about making every dollar count for every patient served. Click below to enroll and start mastering healthcare cost strategy today.